Hi everyone, and this is just a short little video regarding the peripheral nerve stimulator and the policy behind this. So what I want to do is do a short video to kind of go through the major highlights of what's been changed in the policy. So the policy has been updated. First things first is the understanding of what the peripheral nerve stimulator is for. It is used to evaluate neuromuscular blocking agents in our patients. Essentially, we are assessing how paralyzed a patient is. Just note that this neuromuscular blocking agent has to be used with a mechanically ventilated patient. So please make sure you read the policy, go through it. I had to make updates to match and reflect our EPIC orders. So first things first, baseline train of 4 has to be evaluated on 2 different sites. This is recommendation with DHS. Deaconess has this written in the order set, and so it is a requirement to get the baseline train of 4 on 2 different sites. Your sites are the ulnar nerve, which is the preferred site, the facial nerve, and then the posterior tibial nerve. The policy itself has had images added to it where you can see exactly where those electrodes need to be placed. That documentation will be in the EPIC flow sheet vital signs. So under the vital signs flow sheet, you will go to your add group button and you will type in train of 4. That will pull up the group, and then you will have the option to document your site, your milliamps, and then the amount of twitches you had, or your train of 4. So is it 4 out of 4, 3 out of 4, 2 out of 4, 1 out of 4, or 0 out of 4? So that will be where your evaluation is. Your baseline should have 4 out of 4 twitches, okay? That is where you get your baseline, and that is what your patient will get when you are not paralyzed, okay? So, and that will be their baseline. So when it comes to the policy, not only did we add the 2 sites for baseline, but we also had to add the photos just to help. And then when it comes to the peripheral nerve stimulator itself, we use the Sun Stim Plus. And just so you guys know, the dial itself, I think people get confused. This is not your milliamps, okay? The Sun Stim the peripheral nerve stimulator, this is not the milliamps. So if it's at 10, it's not 10 milliamps. So there has been a table added to the policy, and that dial here is 0 to 70 milliamps. So there's been a table added to the policy itself that when you are at a 1, you're 7 milliamps. When you're at a 2, you're at 14 milliamps. So anytime you have a number on here, you just take it times 7, and that will be your milliamps, okay? So I'm going to demonstrate how the peripheral nerve stimulator is supposed to be placed and how the thumb twitch looks on an ulnar nerve. So when you are placing your electrodes, you will have 2 electrodes. You will have a black and a red. First things first, make sure your batteries are functioning, otherwise it will not be working. Also make sure that they're plugged in, okay? You will be choosing sites that are free from edema. If you have an art line here, maybe you should try to avoid that one, go to the other side. IVs, if there's wounds, if there's a lot of hair, trim the hair. If they're really sweaty, you're gonna wanna dry them off, that kind of stuff. Try to avoid sites that have excessive edema too, because that may not be appropriate and you may not be getting an accurate baseline. So first things first, let's go ahead and put the electrode on. So first things first, I'm gonna grab the black one. The black one is going to be your most distal electrode. So if you think about it best, red to the head is kind of a term that we've always used. So ulnar nerve, we're going to find that ulnar artery kind of area, and we are gonna place that black electrode right there. And that's gonna be the furthest away from your head, if that makes sense, okay? Then the red one is going to be placed right above it. So this is what it will look like, okay? So what I'm looking for here is my thumb twitches. Now I'm just gonna go ahead and skip ahead. You usually start at the lowest milliamps and then you work your way up, but I know what my 4 out of 4 twitches is, so I'm gonna go straight to the 4. So train of 4 is the only button you'll be hitting. So that train of 4 button, and you're gonna press it and watch my thumb twitch. See? You're not looking for finger twitches, you are looking for that thumb twitch. And that will be my 4 out of 4 train of 4, okay? Please make sure that you turn this off and when you leave it connected to the patient, because someone can accidentally press the button and then you will be shocking them, okay? Other kind of updates is the way the procedure has changed if you aren't 2 out of 4. 2 out of 4 twitches is your goal when you are paralyzed. That is the goal. Deaconess has listed in their order set what you should do if you're 4 out of 4, 3 out of 4, 1 out of 4, and 0 out of 4. What I've done to make it easier for you guys is created a quick guide kind of paper. So attached to the policy is going to be this paper. So this paper is going to have your table with the corresponding milliamps, what percentage of blockage you have, and then it'll go through the whole process of starting the train of 4 and then monitoring the train of 4, and it'll tell you exactly what you should be doing. This reflects the orders in Epic. So feel free to print these out when you have a patient that needs peripheral nerve stimulation or train of 4 monitoring and getting a baseline. Of course, if you guys have any questions, feel free to come to me. I am here to help. If you have troubleshooting issues as well, I am here to help. From there on, just like I said, please read your policies. Things have been tweaked to reflect Epic and Deaconess policy in certain areas. So I want to make sure that I'm giving you the best education I can. So thank you for your time, and I appreciate it. Have a great day.